Now next drugs, nadolol and timolol, non-selective beta antagonists, will block both beta 1 and beta 2. Nadolol has long duration of action. Timolol will reduce aqueous humor in the eyes. Okay, nadolol has long duration. Now treatment of glaucoma, beta blocker topically applied such as timolol are effective in decreasing IOP in glaucoma, which is required thus by decreasing the secretion of aqueous humor by the ciliary body. And cardiolol, levobunolol, metipranolol, these are all non-selective, whereas betaxolol is only beta 1 selective. Okay, beta 1 selective. So these agents will neither affect the ability of the eye to focus for near vision, nor they will change pupil size. When administered intraocularly, onset is about 30 minutes and it will last for 12 to 24 hours. Beta blockers are the only choice for chronic management for glaucoma. Okay, this is an important table. In acute attack of glaucoma, pilocarpine is the drug of choice. Now this is the table which you should remember. Class of drug: beta adrenergic antagonist, alpha agonist, okay, cholinergic agonist, PG analogs, and carbonic anhydrase inhibitors. First, beta adrenergic antagonists, which we have recently studied: betaxolol, cartilolol, levobunolol, metoprolol, and timolol. They will decrease aqueous humor. This is the mechanism, and side effects are ocular irritation, contraindicated with asthma due to their beta blocking effects, and COPD, bradycardia, and congestive heart failure. Now, alpha adrenergic agonists such as apraclonidine and brimonidine, they will also reduce the aqueous humor and they will also increase the aqueous outflow. Side effects is red eye, ocular irritation, allergic reaction. Cholinergic agonists such as pilocarpine, okay, and carbachol, this will increase aqueous outflow, pain in the eyebrow, and increase myopia, decrease vision. PG analogs such as latanoprost, travoprost, bimatroprost, mechanism is they will also increase the aqueous humor outflow, and same as here, red eye, ocular irritation. For carbonic anhydrase inhibitors, the drug are dorzolamide and brinzolamide, acetazolamide and methaxolamide. They will decrease the aqueous humor production, so transient myopia. Beta adrenergic antagonists will decrease the production, and carbonic anhydrase will also decrease the production. Alpha agonist will decrease the production, okay, and also increase the aqueous outflow, same as cholinergic agonist. PG will increase aqueous humor outflow. You have to remember the class, you have to remember the names and mechanism. Now, acebutolol, atenolol, these are all selective beta 1 antagonists. Betaxolol, bisoprolol, esmolol, metoprolol, and nebivolol. Action: they will lower the BP in hypertension and increase tolerance in angina. Esmolol has very short half-life as it has an ester linkage metabolism. It is only available IV, and it is only used in ICU. Cardioselective beta blockade nebivolol will release nitric oxide from endothelial cells and cause bronchial dilation. Propranolol, which is cardioselective beta blocker, have fewer side effects on the pulmonary function. Therapeutic uses: useful in hypertensive patients with impaired pulmonary function. These are also first-line therapy for chronic stable angina. Bisoprolol, metoprolol are indicated for management of CHF.